Hey class, today we're starting with chapter 17, our diagnostic electrocardiography, and we're going to start off with talking about signal average EKG. So your signal average EKG, your routine EKGs take only a few seconds or a few minutes to perform, but your signal average EKG takes up to about 20 minutes to perform. With this EKG, you have to collect at least 250 consecutive QRS complexes. And you notice you have these very large, wide QRS complexes with your signal average electrocardiogram. And this is used, it can either be done with your routine EKG with a special software attached, or it's done with a special signal average EKG machine. And what this shows is late potential, and that's what these very large QRS complexes are. And these arise from damaged or scarred myocardial tissue. And what this does is helps the doctors to predict a patient's risk of having ventricular arrhythmias, such as VTAC or VFib. Next, we're going to get into talking about stress testing. And stress testing is just another diagnostic procedure that's done to determine the likelihood of a patient having coronary artery disease. And it's done to provide information about how patent that patient's coronary arteries are, or how open their coronary arteries are. So the goal of stress testing is to increase that patient's heart rate to its maximal level, which increases the myocardial oxygen demand, and to evaluate the EKG and the subjective responses of the patient. And so your metabolic equivalent, or according to the exercise protocols, is measured by what's called MET, or metabolic equivalence. And this is the measurement of the intensity of the exercise, and it reflects the oxygen consumption used by the patient. And we're going to stop there today, and tomorrow we're going to pick up and we're going to talk about the relative and absolute contraindications of stress testing. However, let's go ahead and talk about why a patient would get a stress test, okay? So the indications for stress testing would be that patient had is post-CABG procedure in which they had a coronary artery bypass graft, or post-angioplasty evaluation. The doctor may order one for diagnosis or treatment of exercise-induced arrhythmias, to follow up on a cardiac rehab, or to evaluate that patient that has a family history of heart disease. Okay, and now, so tomorrow we're going to pick up and we're going to talk about some of the relative and absolute no-nos as far as a patient getting a stress test. Okay, I'll see you guys tomorrow. Bye-bye.